Two agencies, the Center for Disease Control and Prevention and the World Health Organization, are investigating this outbreak. None of them have called the coronavirus a biological attack. They have traced the origins of this virus back to a seafood and animal market in Wuhan, not to a laboratory. Number two, did the virus originate in Canada, more specifically from Canada's National Microbiology Laboratory, or the NML? Now, reports say that in March of 2019, a mysterious shipment of exceptionally deadly viruses from this Canadian lab ended up in China. Scientists from Canada said the viruses were potential bioweapons. 4 months later, a group of Chinese virologists, later called Chinese agents, were expelled from this lab.
From treating patients to becoming one, the 34-year-old ophthalmologist diagnosed Saturday with the Wuhan coronavirus, dying less than a week later in the same hospital in which he worked. But if action had been taken when he and others started sounding alarms, the severity of the outbreak might have been understood sooner. Struggling to communicate, Lee spoke with CNN briefly by phone on January 31st. You could hear the hospital machines pulsing in the background. It was back in late December when Lee first warned friends on WeChat about a SARS-like disease going around. Lee sent a group message saying that a test result from a patient quarantined at the hospital where he worked showed a patient had a coronavirus. But hours after hitting send, Wuhan city health officials tracked Lee down, questioning where he got the information. Within days, they closed the suspected source of the virus, this seafood market, and they announced the outbreak. But instead of being praised, Lee got a call from Wuhan City Police. With Lee coughing too much and breathing too poorly to speak by phone, we asked Lee by text, "How did you feel when this happened?" "I felt a little afraid I would be detained, afraid my family would worry," Lee responded. He agreed to sign this document, admitting to spreading rumors online and severely disrupting social order. It reads, "We want you to cooperate with the police and listen to our reminder and stop the illegal act. Can you do that?" Lee answered, "Yes, I can." In the weeks that followed, the Wuhan Municipal Health Commission maintained that there was no obvious evidence for human-to-human transmission, no infection of healthcare workers, and that the outbreak was, in their words, preventable and controllable. And with that, the people of Wuhan continued about their normal lives. Then came a sudden jump in infections. China's central government took over, scrambling to contain a spreading virus with a rising death toll. Chinese state media first reported that Lee was one of several whistleblowers silenced by police. Calls for Lee and the others to be vindicated grew online. China's Supreme Court even weighed in, adding, quote, "It might have been a fortunate thing if the public had listened to this rumor at the time." But for many, including Lee and his parents, it was too late. They all contracted the coronavirus. Lee's condition declined rapidly. But before his death Friday, he witnessed the support of thousands online who considered him a hero.
China has put the lives of millions of people at risk and may have already unleashed a deadly pandemic on the world. It is no secret that the Chinese government actively controls the flow of information going both in and out of their borders. This fact is so well known that we call it the Great Firewall of China. China has also become more wealthy and influential over the years, which has allowed them to control how events in the country are covered in the rest of the world as well, as we saw with the coverage of the recent protests in Hong Kong. Now this same censorship apparatus in China is working to suppress information about the spread of the coronavirus and the conditions that are being seen inside the quarantine areas. Over 45 million people in the country, possibly more, have now been quarantined and ordered to not leave the region as fear of the outbreak is spreading. It is obvious that the government waited far too long before taking serious measures to contain the virus, even though the numbers have risen exponentially in the last few days. Despite this evidence, the Chinese government is doing its best to downplay the situation by controlling the media statements and deleting any information from social media that contradicts their official claims. The official numbers from the Chinese government at this point say that there have been 200+ deaths and approximately 10,000 confirmed cases. But videos and photo footage that have been sent to Anonymous shows a far different situation unfolding within the quarantine zone. Footage taken from the contamination zone shows overcrowded hospitals filled with sick and concerned citizens, and other videos show a significant number of infected people dropping over in the street. This is the type of footage that the Chinese government has been desperately trying to wipe from the internet. In fact, some Chinese citizens have even been arrested for spreading information about the virus. This is not unusual behavior for the Chinese government, as a very similar cover-up took place during the SARS outbreak nearly 20 years ago. SARS is also a coronavirus, but the new form seems to be more virulent and deadly.
Our favorite friend, the coronavirus. Now, as an engineer myself who studied at MIT, it's been frustrating for me because I can't get my head around this complex problem, and I don't know who to listen to. When I listen to politicians, I'm reminded that to a certain extent it's their job to lie and get reelected. When I listen to governments, to a certain extent it's their job to withhold information to get us to all work in the way they want us to. Sometimes they can't tell us what they want to tell us, and so you then listen to the scientists, and then you try to look at the history and figure out what's going on.
Conceptions are there about the coronavirus? Because you said there's a lot.
Yes. I think first and foremost, if we start at the beginning, what started the coronavirus, right?
Uh-huh.
So we actually aren't sure what started the coronavirus. Some people have thought there have been snakes. Some people have guessed random animals.
The bats.
Right?
And
Bats, exactly.
And what's that dinosaur-looking mini pangolins? Pangolins. It's this scaly thing, because some people say it came from that. But go on. Let me not cut you off.
Yeah. I mean, people can say whatever animal they want, right? They could say birds. So the fact of the matter is no snake or reptile has ever had a type of coronavirus, right?
Oh, okay.
So coronaviruses are found in birds and they're found in mammals like us, right? And an example of another coronavirus, you probably had this before, is the common cold.
Yeah.
It's another type of coronavirus. So the other two famous cases, SARS, which is severe acute respiratory syndrome, and MERS, Middle Eastern respiratory syndrome. SARS was caused by a type of cat, and then MERS was caused by a camel, and we believe it originated in bats, right? So we had a middleman animal, like a middle animal in between bats and us that caused the diseases.
So bats gave it to camels and camels gave it to us.
Exactly.
So in both these cases, were they eating animals? Were they eating camel meat? And was someone else eating whatever?
You don't have to eat the animal. You can either consume the animal or its products, like a milk, or you can spend time with the animals. And you can imagine in the Middle East, people spend a lot of time with camels, right? So for this one, we don't know what the middle animal is. We don't know what the middleman is. But we do suspect the originating factor is bats, right? But that's kind of beyond the point because we're trying to make sure people don't die and then getting sick. And the other thing beyond that, another speculation is that the disease started at the fish market in Wuhan.
Right.
But there have been a few cases that date before the fish market. So what adds to this, like you're saying,
It was a seafood. Yeah, it was a wild animal market. Yeah. Go on.
Like we were saying earlier, it's difficult for Western journalists and for Western scientists to go in there and see what happened.
I think the virologists have that in mind when they make their decisions. I think all these disease experts are trying to save millions of people from unnecessarily dying. They're trying to stop a disease in its tracks. That's what they're doing, Eddie. They've done this forever with polio. They've done this with smallpox. This is what they do. They try to stop diseases in their tracks. Diseases are trying to kill us every fucking day. It's as if we have a war. And there's a war against viruses. It's almost like a real war against a thing, but we don't think of it as a thing because you don't see it. But it's an attack on the human system. Yeah. It's an attack on human beings, and it's constant and it's evolving. It's always changing. There's too many of us, and that's what it recognizes, and it's trying to get rid of us.
It's crazy.
I'm learning how to fight
How many people have died in the U.S. so far?
50,000.
50.
No, 50.
50. And what is the average age?
Very few.
What is the average age?
81.
And the NBA and all
canceled everything.
Everything canceled.
Well,
There's nobody in the audience.
Well, no, because
and the average age is 80.
Yeah.
You would think, like,
they're worried about going home.
You would think if you just found out about this, you just woke up from a coma, and then you see how everything's canceled.
And it was Ebola.
You would be thinking people were dying on the streets.
Correct.
Running on. It was like the zombie apocalypse.
That's why I'm asking.
Stay home. There's zombies on the streets.
Yeah, that's why.
That's what you would think.
Exactly.
That's what you would think.
You're right.
But the average age of the people dying in the United States is 80, and half of them are from an old folks' home in Washington. How did they get? And then you see in the back of a Lysol bottle, it lists all the viruses that it kills. And it says human coronavirus. I'm like,
it says
isn't this
99%,
new?
yeah.
I thought this was a
And,
new. But it's a different
I was actually
strain.
privy to some
So I'm like,
special information on Friday that a doctor friend of mine forwarded me from a meeting that happened in California a few days ago, and I think this is now fairly public information. I saw similar information on the New York Times website, so I'm not divulging anything crazy, but it basically said this. This whole concept of a containment of a virus is almost by definition ridiculously impossible. It just really won't happen. Possibly, if you would have got to this in 24 hours and literally cordoned off and maybe exterminated people in Wuhan, you might have been able to. But the way this thing is transmitted, it just goes. And so this whole idea of us trying to contain it, it's obviously futile. And we've seen these attempts be futile to contain it in America and Italy and all these other places. And it's just spreading and spreading. And of course, it spreads more, and there's more people infected, probably by a factor of 10 than we even know, because a lot of people don't show symptoms, etc. So now we're in this delay stage. Now, the reason they have the delay is because people that are going to be affected by this virus, and I'll talk about this shortly, are the ones that are sick, that are elderly, that have respiratory problems. Those are the ones that are going to clog up the hospitals here in the UK and in America. And I'm looking down here to the Royal Free Hospital, which is where I'm near. And it means if there's 10,000 people that need respirators because they're getting pneumonia, they'll turn them away and they'll die. If we can delay this, it spreads those cases out and they can handle that reality. So that's an understandable thing. But here is a fact that you need to get your head around. And when I heard about this on Friday, I went a bit low for a while until I understood what was happening. And that's this. 70 to 80% of the population on this planet are going to get the coronavirus, period. That means most likely you and me and your family and your kids. It's going to happen. It's going to happen in the next month or the next 4 months, or it's going to come back next winter and hit everyone. And if we look to history, the Spanish flu, which killed, I think, 40 or 50 million people around the world, about 1% of the population, I think, it came in 1917, but it didn't obliterate the population until 1918, when it came back in the winter flu seasons where everyone's immunity is low, and it nailed everybody. And so learning from that, we need to understand that it's actually in everyone's interest to get this flu. Now stay with me for a second, because that sounds really crazy. First of all, man has been battling our immune system against the world's viruses for millions of years, and we've adapted. When you were born, you were actually born in your DNA with a version of every virus that your ancestor had and attacked and figured out and passed on to you. When you were a kid, you learned by getting sick. Some of you got injections for smallpox, and that was learning about those viruses, and now your immune system's fairly strong. No human in the world has ever seen this virus because it's new. It was made up of, Lord knows, some bat and some cat and who knows. And so it means no one's immune, and we're all going to have to use our system to fight this. And so the truth is, the sooner we can all get it, the better. And that's why you hear this term, the herd immunity. And they reckon if 60% of us get it, we can actually stop this thing from spreading, because you won't spread it and you'll be strong enough to keep it from spreading to the people that are in danger. And so that's like almost counterintuitive to what we've been told. We get in this panic, I'm going to lock myself up in my house and I'm not going to get infected. Most likely you're already infected. And there's really nothing you can do in a major population not to. And the truth is, why not get infected now in the summer before it happens again in the winter? Here's a few other parts of the news. So the quote unquote bad news is we're all going to get coronavirus. The good news is that a small percentage of us will die. Now, the numbers are still out right now, but the latest intelligent numbers say about 1%. But this is really moved out on the spectrum. We're seeing very few children or no children dying from it. Healthy adults from, say, 18 to 40, it's like 0.2% is what they reckon. And then 50, 60 and over, it's like 10 to 15%, and anybody with respiratory issues.